When you look in the mirror, does it ever look like this? Or this? Or this? Neck humps are not normal, but more often than not, they're not permanent either. The truth is, you can start doing things today that are not only going to increase your quality of life, decrease your neck pain, and also start to shrink that neck hump that's been growing on your back. Neck humps, also known as dowager's humps, are something that society has just decided to sit back and accept. When you get older, this is what you look like. In fact, it's estimated that 20 to 40% of adults over the age of 55 have a dowager's hump, but it doesn't have to be this way. If you keep up with these exercises, doing them every day, you are going to see results. And if you take a look at these two pictures, this is one of my clients named Paula. Now, Paula came in and she had severe back pain, some neck pain and shoulder pain. She would describe herself as her head feeling heavy on her shoulders, right? And you can see in this picture that her head is way forward. It's no surprise that it feels heavy. But she did these exact same exercises for 6 weeks, and you can already see the difference that they've begun to make. Hi, my name is Dr. Tyler Siedentopp, and I'm a doctor of physical therapy here at Village Fitness and Physical Therapy. Now, what is a neck hump? Now, there are two main types of neck humps. Colloquially, these are called a dowager's hump and a buffalo hump. Now, while these pictures may look similar, the cause of them is actually very different. The dowager's hump is medically referred to as hyperkyphosis, which just means that there's an excessive amount of flexion in the thoracic spine. Now, the hump that we see is actually the curve of that thoracic spine that is now protruding out from your back. So if you touch it, it should feel pretty stiff. But that's because it's the spinous processes of your spine sticking out into your back that you can feel. Now again, when you touch it, it'll feel stiff. It should feel like a bony spot because you're actually pressing on the spinal vertebra. This is strongly related to your posture. The buffalo hump, on the other hand, is referred to as a dorsocervical fat pad. Now this actually forms from a more hormonal imbalance in the body from things like Cushing syndrome. Well, this can happen when there's too high levels of cortisol in the body ends up going into fat storage mode. That high level of cortisol stimulates fat production and storage in the body, and one of the places that the body likes to put it is right behind your neck here. But this being a fat pad means that when you go to touch this, it's going to be a lot squishier. So if this is more what you're thinking about, there could be some things going on with your medication or potentially some hormonal imbalances that you should talk with your general practitioner about. So should you care about your neck hump and posture? Well, actually, studies across the board show that good posture is beneficial for your musculoskeletal, digestive, and mental health. When your posture is aligned well, this limits the amount of stress and tension on your muscles, ligaments, and joints, leading to a longer life without pain. But prolonged time in poor postures actually leads to a deformation of these tissues and can lead to those poor postures becoming more and more permanent, leading to more pain, more compression, and more tension on all of those tissues. That's why, as our population is getting older, you see more and more of these poor postures becoming more and more stiff. That's because these people have been in their postures for that much longer of their life, their tissues have started to change, and now they can no longer get out of this position. A 2010 study published in Manual Therapy actually showed that in the group of patients with neck pain, they actually had an average of 7 degrees more forward head posture than the group that without neck pain. Later, in 2019, a systematic review looking at all of the posture and neck pain research that has been done, what they found was that forward head posture, while it was present in adolescence, did not always predict neck pain. So the teenagers that looked like this didn't necessarily have neck pain. However, when it looked at adults, this forward head posture definitely correlated with that neck pain. So that means for our teenagers, if we're sitting in bad positions for a long time, this might not be affecting you now, but over the years, as this begins to grow, this is going to start to change these tissues and cause pain, and that's where I don't want you to be. Interestingly enough, your posture doesn't just affect your muscles and ligaments. A 2003 study looked at digestion and the movement of gas through your digestive system in various postures. And what they found was that poor postures actually impeded some of that gas moving through your digestive system, as opposed to sitting upright or walking around. So this could mean your bad postures could also be contributing to some of those feelings of bloating or poor digestion issues. And in regards to mental health, a study actually looked at people walking in a slouched position, versus an upright and posture position. And they actually showed that the people walking upright showed better scores with being less sleepy, higher energy, and actually better mood states, which is amazing. And if you're thinking, oh, was this just a placebo effect? There was a study where they actually manipulated people's postures based on how they were sitting at a desk about to take a test. So someone with a low seat and a high table would have to sit upright to be working. Someone with a high seat and a lower table would have to end up slouching as you're going there. Believe it or not, the same results came out. The people who had upright posture not only had better alertness and awareness in the class, they were more able to recall the information that they needed to remember for the test as compared to their colleagues who were crouched over in a high chair with a low desk. So posture plays a way more important role than we just give it credit for many of the times. So I hate to tell you this, but your mom was right. Your posture is important. And if you stay in that position for too long, you just might end up that way. But how did we get here? Let's think about the Grand Canyon. Thousands and thousands of years ago, probably wasn't that grand. Probably was just a stream, right? But over time, that river continued to do the work of eroding that space more and more until now we look and see there's this huge chasm, this big, vast canyon that we get to look across. Similarly, our posture did not get bad overnight. We've been in bad postures for long periods of time, over years oftentimes, that have now created deformations in our tissues that make it that much harder to get out of those positions. This picture here demonstrates something called upper cross syndrome. And this is really the crux of many of our neck hump and postural issues. And if you follow the lines here, you can see muscles that become weak and muscles that become tight, that begin to put us in these bad positions and keep us there. Now imagine your muscles like rubber bands. Now, if a rubber band is stretched out for a really, really long time, it's eventually going to be too stretched, right? And it won't be able to kind of snap back like it normally should. That's what I would call a weak muscle. It's a muscle that's been overstretched for way too long and now doesn't quite have the tension that it needs to pull us back into the right spot. On the other hand, imagine a rubber band that is really, really short. It's shrinking, right? It's getting tighter and tighter. Now, if you go to try and pull that rubber band, it's not gonna wanna stretch at all. Those are the tight muscles in our body. So looking at this picture, there are two kinds of muscles here. We have our tight muscles and our weak muscles. Now, imagine my forward posture being into this position. Now, what you'll start to see is I have some really tight and short muscles that are back here. These muscles are holding my head up like this. The other tight muscles, if you follow that line, are coming down into my chest, pulling my shoulders forward here. Now, if I hang out here long enough, these muscles are gonna start to actively shorten, and it's gonna be that much harder for me to get back to standing upright because I'm stretching these muscles. Not to mention, we also have weak muscles here. The muscles that become weak from this position are the ones that are overstretched. So these muscles in the front of my neck that should be holding me here are overstretched and not working. They can hardly beat against the tug of war of these tight muscles. Not to mention all of these muscles down here in your back and shoulders that should be able to hold you upright here. Weak, overstretched, not doing their job. Combining those weak and tight muscles together is what's the deformation that's happened over the time of our poor postures. So we need to go and address those specifically in order to start fixing your neck hump. So how do we address weak muscles and tight muscles? Well, the truth is we approach them very differently. For a tight muscle, we're gonna be adding in some stretching techniques to take that tight rubber band and get it back to that normal length so that it's a nice, healthy place that can contract and relax as it needs to. For our weak muscles, we need to actually practice strengthening them and coordinating them. And this is oftentimes harder because you can't muscle through strengthening a muscle like you can just muscling through a stretch, right? It takes mental practice to turn on a muscle that's been turned off for a very, very long time. So we need to get that muscle strong and coordinated again. So there's gonna be 3 exercises that I want you to do every day, starting today, that are gonna start to strengthen those weak muscles, increase their coordination, and also stretch out those over-tightened muscles to begin to correct your poor posture. First exercise is what we call a chin tuck. So you might be thinking of a chin tuck as putting your chin into your chest like that, but I don't want you to do that. I want you to imagine one of your friends back in middle school or high school brought something really gross and tried to put it in your face. What are you gonna do? You're gonna go, ugh, that's gross. That kind of chin tuck is where we're gonna be activating these over-lengthened muscles that have become weak and really trying to turn them on and keep our neck out of that forward head posture position. So what that looks like when you're doing repetitions is starting here, you're going to come back, almost giving yourself a double chin, and then relax. Come back, activate those muscles, and then relax. And you can do this for 3 sets of 10 every day, and you'll start to notice, 1, that it becomes easier to turn these muscles on as you practice this, and 2, that your starting point will be starting to get closer and closer to that good posture. The next exercise I want to show you is the thoracic spine extension. Now this is important because we've been focusing on the neck, those overstretched muscles and those too tight muscles. But the neck is sitting on top of the rest of the spine. And if we've been in this forward head posture for a long time, those tissues of the thoracic spine might have begun to get stiff. And that's that position that you see those people in that never ever come out of this position. So we want to start giving some more mobility to these joints so that the muscles can do their work. So how we're going to do that, you're going to have your hands behind your neck, just like this, to support your neck. Then I want you to bend backwards over a chair that has a nice stiff back, and you'll feel that we're actually targeting one of the thoracic spine vertebra here. So you're gonna feel a stretch, and it might feel stiff, and that's totally fine. And the cool part is, we've been addressing one spinal vertebra there. If I wanna go a little bit up, I'm gonna slide down in my chair, and now I'm working a little bit higher up on my back. And again, we're getting more mobility at the next vertebra. Now you can go up and down the thoracic spine of your back to begin to give yourself little bits of motion at each joint. And that's really how our back moves in great angles, right? If we have a little bit of motion at each joint, then we can have full mobility of the lumbar and the thoracic spine. The last exercise is called scapular retraction. And it's a fancy word for pinching your shoulder blades behind your back. But what we're doing here is actually going to be addressing some of those tight muscles while also strengthening some of those weak muscles. So it's kind of a 1-2 punch. So this exercise, I'm going to show you from behind so that you can see what's going on. I want you to start with your arms out in front of you. And as you rotate your arms outwards, you're going to pinch your shoulder blades behind you. Imagine you were pinching a pencil between your shoulder blades. This pinching is not only strengthening the muscles that are meant to hold yourself in an upright posture, but you should also be feeling a stretch in the front part of your shoulders here. So we're stretching those tight muscles and strengthening those weak muscles that have hang around in the back. When you do this, you can do 3 sets of 10 every day to continue strengthening and stretching those muscles. Now, all 3 of these exercises are essential for you to begin to make changes in your neck hump and posture. Now, just like the Grand Canyon wasn't carved overnight, our bad posture didn't all of a sudden just show up overnight. Our good posture, our improving posture, is not going to happen overnight. The truth is, your posture is important, period. There's no more sitting around thinking that it's just going to go away on its own. But these exercises that you can do every day are going to benefit your ligaments, your muscles, your joints, your digestion, and your mental health. So it's time for you to start making a change today. Good luck, and I'll be there alongside with you. From all of us here at Village, we're cheering you on as you go on this journey to reclaim your health and redefine your age.